So one of the really interesting things that has come out of the research in the orthobiologic space, that's things like PRP and stem cell therapy, is this concept of delaying disease progression. Now, what I'm mainly going to talk about here are things of degenerative nature. So things like osteoarthritis or a rotator cuff tear, so supraspinatus tear, infraspinatus tear, things like that. And the holy grail of regenerative medicine is obviously that we have what's called a disease modifying agent or reversal of a condition. So as an example, you take someone who has bone on bone knee osteoarthritis, which is also called stage 4 osteoarthritis. You do a procedure, you get actual regrowth of cartilage such that it actually reverses the staging of their disease, where they could potentially move into a stage 3 or stage 2, which are milder forms of the structural changes that occur with things like osteoarthritis. Now, what is unfortunate is at this point, we don't really have that. There may be some emerging literature in other countries outside the US who are using culture expanded stem cells and maybe seeing some repair and true regeneration with very, very, very high dose mesenchymal stem cells. But that's not the point of today's discussion, because one, that's outside the US, and two, I think that's still very far away. But when we are looking at things that we can do and these degenerative diseases like rotator cuff tears or knee osteoarthritis, we don't have that literature showing that if we do those therapies that, consistently in a majority of patients, we are going to actually reverse or cure the disease. And so one of the things, though, that's been interesting now that there has been a lot more research and more time has passed since the first studies, is there's studies starting to show that, hey, if we do these therapies, we might not be reversing them, but it might actually be halting or delaying the progression. I think that is extremely, extremely fascinating, because what it's saying is that if you have, let's say, stage 2 knee osteoarthritis, which is mild, and you do a stem cell therapy, there is X% chance that in 10 years, 15 years, 20 years, that it has not progressed past stage 2 into stage 3. Whereas compared to the average population who does not undergo that, you have X% of patients who are going to progress to stage 2, stage 3, and eventually a conversion to the only considered cure for knee osteoarthritis, which is a knee replacement. And so we're starting to see some of that literature. And I think that literature is really, really interesting and really fascinating, because it's opening up new conversations with patients. So I had a conversation with a potential patient today who is looking at treatment options for knee osteoarthritis, and their goal is to delay a knee replacement. And one of the things that they were super excited about and wanted to ask about was peptides, right? Can peptides help my knee? This is where it's extremely crucial to start to understand what different therapies can do for us and how they may be impacting the disease state, and then therefore the things that we are going through. And in our experience, peptide therapy can be extremely helpful for helping to manage the symptoms associated with something like knee osteoarthritis. There's no evidence to suggest that taking BPC or TB500 or GHK copper or the growth hormone secretagogues is going to delay the progression of knee osteoarthritis. However, there is evidence suggesting that this can and does happen with really high quality PRP and stem cell therapy. And so when we're looking at, well, what are the goals? What are you wanting out of working with, whether it's us or just in general? This is not a pitch to work with us, but you have to know what those goals are so you can tailor the treatment towards it. If somebody's goal is to just get through the next 2 years, which is roughly when their orthopedic surgeon will do the knee replacement, then spending the money on a stem cell procedure might not be the best option. It might just be better to go get steroid injections and do some supplements or some oral anti-inflammatories. Basically, Western medicine has got that kind of down. If you need to kind of get through until your knee replacement, just throw the steroids at it until the steroids no longer work. Is that a great option? No, I don't think so. But if that's the goal, if the goal is just to survive until the knee replacement, then that's feasible. Now, if someone wants to thrive until their knee replacement, then we might start looking at peptides. Then we might start looking at things that are not necessarily delaying the progression of arthritis, but are managing the symptoms associated with the arthritis, then we start to have those conversations. And we're not really having the discussion on, oh, we should be looking at doing a stem cell procedure because X, Y, Z. But if someone comes and says, I want to avoid or delay a knee replacement, a hip replacement, a lumbar fusion, whatever it is, we have to start to look at the evidence to say what evidence is out there that the therapies that we're recommending are actually going to do that or not do that. And currently, we're starting to see evidence in the orthobiologic space that we can delay the progression for big surgeries like knee replacement, like hip replacement. And we're just not seeing that with a lot of other things. You're not going to take enough curcumin over the next 10 years to delay the progression of your knee replacement. I haven't seen any evidence for that. And so things to think about when you are exploring this orthobiologic space is what are your goals? And then when you're talking with providers about different options, how are those options actually being directed towards those goals to ensure that down the road, if you're wanting to avoid a knee replacement, you didn't just waste your time doing something that's only just managing your symptoms, and you're actually putting things towards something that has the ability to actually delay progression.